pores look stuck? Tonight we'll do a barrier-safe deep cleanse and remove only what's ready. Pure ASMR, clean technique, no pain, no drama. Tools are pristine and ready. Gentle glove snap, calm T-zone focus, no fluids, just clean, controlled technique. Settle in. Tonight's roadmap: condition, cleanse, exfoliate, optional micro-release, then soothing aftercare. Simple, barrier-safe, ASMR calm. Our first step is to gently condition the skin. We begin with a soft compress, using a clean towel soaked in warm, never hot water. High temperatures can strip your skin's delicate moisture barrier and cause irritation, which is the opposite of our goal. The ideal temperature is comfortably warm to the touch, creating a soothing, gentle steam. This warmth is the key to preparing the pores for the next steps in our routine. Drape the towel over the areas you intend to treat, typically the T-zone, your nose, the surrounding areas, and your chin. Let it rest for 2 to 3 minutes. This isn't about forcing anything open, it's a moment of calm preparation. The contained warmth and moisture work together to soften the hardened, oxidized tops of any sebaceous filaments or blackheads. If you're wearing heavy sunscreen or makeup, an optional micellar water swipe is a good idea. This pre-cleansing step gently lifts away any surface residue without friction, ensuring our next treatment can work directly on the pores themselves. Just a light single pass is all you need. Think of this entire conditioning phase as simply softening the cap of the plug. It's a common myth that we can open and close our pores. They don't have muscles. Instead, by softening this hardened surface, we are making the contents more accessible for the gentle removal to come, ensuring the process is effective and, most importantly, safe for your skin barrier. On dry skin, massage a few drops of oil, emulsify to a soft milk, then a feather-light rinse. No tugging. Breathe. Follow with a gentle gel cleanser across the T-zone. Choose formulas for oily, combination, or dry skin. Keep pressure minimal. Skin should feel silky, not squeaky. Glide under your fingertips confirms clean without stripping your barrier. Hands off while water rests. Let micro droplets settle. Imagine a calm 30-second timer ticking softly. Map, don't flood. Press a BHA only on nose and chin, exactly where congestion lives. Keep cheeks mostly untouched. We're targeting, not exfoliating the whole face. Less is kinder. Optional enzymes. Mix papaya or pineapple with cleanser, then gently sweep the T-zone, short and sweet. Short clay mask just on oily spots. Thin, even coat. Never let it crack or overdry. Safety first. Avoid broken skin and active irritation. Stop if you feel sting or heat. We now arrive at the most delicate step, the micro-release. This is an optional step, reserved only for blemishes that are truly ready. To prevent damage, we must learn to read your skin's signals using a simple traffic light system. Hygiene is non-negotiable. Always work on clean, dry skin. Sanitize any tools with 70% isopropyl alcohol before every single use. First, the green light. These are the only blemishes eligible for a micro-release. A green light is a surfaced blackhead with a dark plug, or a whitehead with a soft, visible tip. In both cases, the surrounding skin must be calm, not red or inflamed. This signals the contents are near the surface and can be released with minimal pressure. Next is the yellow light. This signifies caution. A yellow light blemish is a closed papule, a small raised bump with no visible head, often called a blind pimple. The inflammation is deeper. Attempting to extract these is a mistake. It will only spread bacteria and cause scarring. Do not extract. Instead, use a spot treatment or a hydrocolloid patch. Patience is key. Finally, the red light. This is an absolute stop sign. A red light indicates a hot, painful, or cystic lesion. These are large, inflamed, and feel sore deep under the skin. Never attempt a DIY extraction on a red light blemish. The risk of severe scarring is extremely high. These should only be addressed by a dermatologist. Respect the red light. If you have a green light, let's proceed. If using your fingers, create a barrier by wrapping your index fingers securely with a clean, soft tissue. Never use bare fingers. The next step is crucial. Anchor and stretch. Place your fingers or tool on either side of the blemish and gently pull the skin outwards, making it taut. This helps open the pore and disperses the pressure. For a blackhead, use a directional roll. Position the sanitized loop slightly past the pore. Apply very low, even pressure as you slowly roll the tool back. The plug should release easily. If it doesn't, do not press harder. For a surfaced whitehead, use a Q-tip cross compress. Hold 2 cotton swabs at a 45-degree angle on opposite sides. First, press gently inward, then, holding that pressure, simultaneously roll the swabs slightly upward. The pressure should be minimal. Finally, adhere to the rule of 2. This is your ultimate safeguard. You are allowed a maximum of 2 gentle tries. If the blemish does not release easily after 2 soft attempts, you must stop. This is a clear signal from your skin that it is not ready. Forcing the issue will only lead to damage. If it resists, leave it. Aftercare begins. Saline sweep on gauze, then a gentle pat dry over the T-zone. Precision dab of salicylic on openings only. Micro-touch, then let it sit undisturbed. Seal with a tiny hydrocolloid patch. Press and hold to adhere, then relax. Calm the area with a wrapped ice roller. Slow, even passes to soothe. Press, don't swipe, a soothing essence. Then pat on gel moisturizer in even layers. Daylight step, pat on a lightweight SPF. Reapply as needed, especially on the T-zone. Set your rhythm. Mark gentle check-ins on the calendar, consistency over intensity. On schedule, map press a BHA to the T-zone. Small, precise drops, then pause. Dot a pea-sized retinoid, cheeks and forehead. Buffer with moisturizer if needed. Go slow. Press in a barrier serum, no rubbing, until it quietly settles. Watch oilier zones. Short timers help prevent over-cleansing and keep balance. Mini refresh. Enzymes. Brief clay on T-zone, then a calm rinse. Done. Quiet rituals. Fresh pillowcase. Wipe your phone. Clean tools. Small habits matter. And now, we can breathe and observe the results. Look closely. The goal was never to erase our pores, but to gently clear and calm them. You can see the redness has subsided. The texture around the nose and chin appears smoother, more refined. The skin isn't tight or stripped. It feels balanced, hydrated, and deeply comfortable. This is the beauty of a barrier-safe approach, achieving clarity without compromising the health of your skin's delicate ecosystem. It's about working your skin, not against it. This gentle, consistent care is what creates lasting peace and resilience for your complexion, proving that effective treatment can and should be a soothing, restorative ritual. Breathe. Your skin has its own unique story and needs. For a personalized routine, I would be honored to help. In the comments below, tell me your skin type, oily, combination, or dry, and your most persistent zone of congestion, whether it's the nose, chin, or jawline. I will personally review and pin a custom mini-map just for you. And if this session brought you a moment of peace and clarity, a gentle tap of the like button is always appreciated. It lets me know you'd like to see more barrier-safe ASMR facials in the future.